Thank you for joining me. I'm Dr. Branyon with New Hope Unlimited. I want to share something with you today that is very dear to my heart. My mother died at a young age of gastric stomach cancer. If I just knew then what I know now, maybe I could have helped her more. So that is one of the reasons that I love to research. I love to get the latest, greatest, best studies I can from all over the world. Japan puts out a lot of really good studies on cancer. Chiba University in Japan, I'm going to have to spell it because I apologize, I may not be saying the name correctly, but it's Chiba University in Japan, just completed a study on Epstein-Barr virus, also called EBV, like Edward, Boy, and Victory. But Epstein-Barr virus is a virus that is very common in the United States. And I hate to say it, but I would say 50% or maybe more of the United States population has this virus, and most people don't know about it. We actually did our own research in a roundabout way and found that 7 out of 10 people that we tested, or blood that we tested, did have either Epstein-Barr virus or cytomegalovirus. Cytomegalovirus is CMV. We'll talk about that some other time, but right now I've only got time to talk about the Epstein-Barr, which is very important. Epstein-Barr virus, you can get it at any age, but if you remember maybe years ago when we were teenagers, someone would say, oh, I've got mononucleosis. Well, what's mononucleosis? Well, back then it was considered the kissing disease. Well, people didn't know really what that was. But really, to make it real simple, let's talk about the symptoms of Epstein-Barr. Sometimes it can be a sore throat, an earache, swollen lip glands, a cough. It can be flu-like symptoms. And then it can basically go away, or at least we think it goes away. You can have it as a teenager, a child, adult, older person, and not actually really get that sick, but you just get fatigue, and maybe one day you might have a low-grade fever, but you just didn't feel real good. And then it seems like all of a sudden you find days that you're just so fatigued. You go to the doctor and they don't find anything, but the problem with that is a lot of doctors, they're great doctors, don't get me wrong, but sometimes doctors forget that there is these certain viruses that after a while do not present with the true symptoms that start. For instance, you may have this sore throat and cough and flu-like symptoms, but those are going to go away. But sometimes maybe never does that fatigue go away. So it's mislooked a lot of times. This study that came out shows that 8 to 10% and possibly more patients diagnosed with gastric stomach cancer have had Epstein-Barr virus. What happens is that virus, the symptoms will go away, but the virus will lay low and dormant and stay there and only peep its little head out every so often just to give you a few symptoms, but then they're so light that at times you just kind of have a bad day. You don't really feel like getting out of bed, but you do anyway. And then the next day you feel better. But for some reason you're dragging, it seems like all the time you're dragging, and you think it's from stress, overworking, and all that. Well, since it has been proven that it is one of those viruses that can cause cancer. Now I'm going to say cancer because the only study that's been done so far, to my knowledge, or that I can get my hands on, is about gastric or stomach cancer. I believe that it's in a lot more type cancers. So one of the biggest reasons I wanted to give you this is a blood test, a simple blood test out of the arm. It's not expensive, and it's called an EBV, Epstein-Barr virus test. Can come back and it can tell you if it's positive or negative. It can tell you if it's lying dormant. It can tell you if it's pretty active. I think that's important, and it's preventative. It's preventative for cancer. Now, let's say you did come back positive. It may take some antibiotics if you're going the traditional way, but it can also take some natural I don't want to say remedies, but like the immunotherapy that we do or someone else does. Stuff can get rid of that virus. So I think no matter which route you go, alternative, holistic, origination medicine, or traditional, it pays to do preventative medicine. And this is one virus that does not get talked about. So I wanted just to educate you, to let you know it's important. Epstein-Barr virus can be gotten rid of, and it can be your preventative, huge preventative to keep cancer away. Thanks for listening to me. Love you, and have a wonderful rest of the day.